Welcome to the module Sepsis Basics, a frontline forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why is this? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about sepsis. What you know and how you use that information improves the quality and safety of the patients in your care. This learning module, Sepsis Basics, is the first in a two-part series that explores the important role direct care staff have in both the prevention and early recognition of sepsis. You are viewing the first module of the series, which provides a general overview about sepsis. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Upon completion of this module, you will be able to define sepsis, recognize who is at risk for sepsis, describe the effects and complications of sepsis, and list the signs and symptoms of sepsis. Sepsis is the body's overactive and toxic response to an infection. Usually, the immune system works to fight any germs, such as bacteria, virus, fungi, or parasites, to prevent infection. If an infection does occur, the immune system will try to fight it. However, for reasons researchers don't understand, sometimes the immune system stops fighting the invaders and begins to turn on itself. This is the start of sepsis. It is a life-threatening condition that arises when the body's response to an infection injures its own tissue and organs, and it is a leading cause of death and healthcare spending around the world. Studies investigating survival and sepsis deaths have reported slightly different numbers, but it appears that on average, approximately 30% of patients diagnosed with severe sepsis do not survive. When the body is experiencing this toxic response to an infection, not enough oxygen reaches the tissues. So, if sepsis is not recognized and treated promptly, this lack of oxygen can result in organ failure, tissue damage, and/or death. Bacterial infections cause most cases of sepsis. However, sepsis can also be a result of other infections, including viral infections such as COVID-19 and influenza, or fungal infections. Infections that lead to sepsis most often start in the lung, urinary tract, skin, or gastrointestinal tract. The most frequently identified pathogens that cause infections that can develop into sepsis include Staphylococcus aureus, often referred to as staph, Escherichia coli or E. coli, and some types of Streptococcus or strep. COVID-19 can have a similar presentation and a similar clinical course to some forms of sepsis. Many residents who require hospitalization for COVID-19 have signs or symptoms that meet the definition of sepsis. What are the risk factors for sepsis? The obvious risk factor is infection. Any infection, from the tiniest sores, such as a bug bite or a hangnail, to the more severe, such as pneumonia or meningitis, can trigger sepsis. The infection can be bacterial, viral, fungal, or parasitic, but some people do have a higher risk of developing infections and sepsis than others. Those at the highest risk of developing sepsis include the very young and the very old, as well as people with chronic or serious illnesses such as diabetes and cancer, and those who have an impaired immune system. People who are malnourished can also contract infections more easily. In the United States, differences in health and the likelihood of death are influenced by both socioeconomic status and our race and ethnicity, and sepsis is no exception. For example, Black and other non-white individuals have nearly twice the incidence of sepsis as white individuals and also have a higher incidence of severe sepsis as compared to white individuals. In addition, American Indians and Alaskan Natives are 1.6 times more likely to die from sepsis as the national average. Some reasons for these health inequities include racism, poverty, unequal access to resources that promote health, unequal access to quality health care and treatments, different rates and types of stressors, healthiness of one's residential and neighborhood environment, and the development of preventable chronic health conditions. In addition, income differences are also significantly related to sepsis awareness, with 15% more of those with higher income have heard the term sepsis as compared to those with lower income. As mentioned earlier, the very old are more at risk for sepsis. As many of you care for older adults, keep in mind that these things contribute to this increased risk. An increased incidence of two or more medical conditions, more prone to urinary tract infections, which are a common source of sepsis, more likely to be malnourished, an increased incidence of the presence of drug-resistant bacteria, which makes it more difficult to treat infection, and a declining immune system, which makes one more susceptible to infections. The early identification of signs of sepsis is important so treatment can begin quickly. Sepsis is one of the most under-recognized and misunderstood conditions. Early recognition improves survival rates and helps avoid complications due to sepsis. The death rate for sepsis is more than 8 times higher than that for persons admitted to the hospital for other conditions. Early signs of sepsis include fever or feeling chilled, confusion, sleepiness, fast heart rate, fast breathing or shortness of breath, extreme pain, or pale or discolored skin. And symptoms of sepsis is to think it is about time, since sepsis is an emergency and must be treated quickly. T is for temperature. A person with sepsis may have a high or low temperature. They may also be shivering, complain of feeling really cold, and or have clammy or sweaty skin. I is for infection. Watch for any sepsis symptoms, particularly if a person has a known infection. M is for mental decline. A person with sepsis may be more confused and or more sleepily than normal. And E is for extremely ill. In addition, the person may have trouble getting their breath and or be in extreme pain or discomfort. The next sepsis module in the series will cover what you should do if you notice signs of sepsis. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Sepsis Basics quiz on the Frontline Forces webpage or in the YouTube description below.